Hey guys, this is Fixer Med. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 59 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at otitis media. Hearing is diminished due to pressure on the eardrum and reduced movement of the ossicles. Taste may be altered if the chorda tympani is affected. Posterior spread of infection can cause mastoiditis. Infection spreading to the middle cranial fossa can lead to meningitis or temporal lobe abscess, while spread through the floor can result in sigmoid sinus thrombosis. Let's next take a look at perforation of the tympanic membrane. Perforation may result from otitis media and can cause middle ear conductive deafness. Other causes include foreign bodies in the external acoustic meatus, excessive pressure, for example diving, and trauma. The chorda tympani, which is closely related to the posterior surface of the tympanic membrane, may be damaged, leading to loss of taste in the anterior two-thirds of the tongue and affecting secretion of the sublingual and submandibular glands. Minor perforations heal spontaneously. Larger ones require surgical repair. Let's next take a look at thyroid and parathyroid glands. Hormones. The thyroid gland is the body's largest endocrine gland. It produces thyroid hormone, which controls the rate of metabolism, increasing body temperature, and calcitonin, which regulates calcium metabolism, reducing blood calcium levels. The thyroid gland affects all areas of the body except itself, the spleen, testes, and uterus. The parathyroid glands produce parathormone, PTH, which regulates the metabolism of phosphorus and calcium in the blood, increasing calcium levels. The parathyroid glands target the skeleton, kidneys, and intestines. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 6-year-old boy is brought to the clinic by his mother because of ear pain and decreased hearing in his left ear. On examination, the tympanic membrane is bulging and erythematous. He also has a reduced sense of taste. Which of the following complications is most likely if the infection spreads posteriorly? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, mastoiditis. Otitis media can lead to mastoiditis if the infection spreads posteriorly to the mastoid air cells. Mastoiditis is characterized by inflammation of the mastoid process and can result in symptoms such as fever, ear pain, and swelling behind the ear. This condition requires prompt medical treatment to prevent further complications. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Meningitis is a serious complication that can occur if the infection spreads to the middle cranial fossa, but it is not the most likely outcome of a posterior spread. B. A temporal lobe abscess can develop if the infection spreads to the middle cranial fossa, but it is less common than mastoiditis with posterior spread. C. Sigmoid sinus thrombosis can occur if the infection spreads through the floor of the middle ear, but this is also less likely with posterior spread. E. Loss of taste over the anterior two-thirds of the tongue can occur due to damage to the chorda tympani, but this is a symptom rather than a complication resulting from the spread of the infection. E. The facial nerve controls the muscles of facial expression and does not affect eye movement. Damage to this nerve would result in facial muscle weakness, not an inability to move the eye laterally. All right, now that we have covered this question, let's move on to look at the next question. A 25-year-old woman presents with severe ear pain and sudden hearing loss after experiencing a traumatic injury to her right ear while scuba diving. On examination, there is a visible perforation in her right tympanic membrane. Which of the following symptoms is most likely to occur if the chorda tympani nerve is damaged? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, loss of taste over the anterior two-thirds of the tongue. The chorda tympani nerve, a branch of the facial nerve, cranial nerve 7, traverses the middle ear and is closely associated with the tympanic membrane. Damage to this nerve due to tympanic membrane perforation can result in a loss of taste sensation over the anterior two-thirds of the tongue and affect the secretion of the sublingual and submandibular glands. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Loss of sensation in the outer ear would be more indicative of damage to the auriculotemporal nerve, not the chorda tympani. B. Decreased tear production would be related to damage to the greater petrosal nerve, another branch of the facial nerve, rather than the chorda tympani. D. Vertigo and dizziness are more typically associated with inner ear pathology or vestibular nerve damage, not perforation of the tympanic membrane affecting the chorda tympani. E. Facial muscle weakness would result from damage to the main trunk of the facial nerve, cranial nerve 7, rather than its chorda tympani branch. All right, now that we have covered this question, let's move on to look at the next question. A 52-year-old woman presents with fatigue, weight gain, and a noticeable swelling in the neck. Blood tests reveal elevated levels of thyroid-stimulating hormone, TSH, and low levels of free thyroxine, T4. Additionally, her calcium levels are below the normal range, which hormone produced by the parathyroid glands is likely responsible for regulating her blood calcium levels. All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, parathyroid hormone, PTH. Parathyroid hormone, PTH, produced by the parathyroid glands, plays a crucial role in regulating calcium and phosphorus metabolism in the blood. PTH increases blood calcium levels by stimulating calcium release from bones, increasing calcium absorption in the intestines, and reducing calcium excretion in the kidneys. The patient's low calcium levels suggest a dysfunction in PTH regulation. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Calcitonin, produced by the thyroid gland, lowers blood calcium levels by inhibiting bone resorption and would not be responsible for increasing calcium levels in response to low calcium. B. Thyroid hormone regulates metabolism and does not have a direct role in calcium homeostasis. D. Cortisol, produced by the adrenal glands, is involved in the stress response and metabolism of glucose, but it does not regulate calcium levels. E. Insulin, produced by the pancreas, regulates blood glucose levels, not calcium levels. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is Fixer Med signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.